basically only 2 additional drills that when you buy, they will go into the slot here of step 1 and step 2. Okay. Additionally, it is advisable in the 2-piece to get rid of the basic ratchet and to get the torque ratchet. Okay, because you need to tighten the abutment screws and you need to check the insertion torques on the 2-piece, not let it exceed 45. Okay.
Okay.
Addition to that, you will have the SDL, that is the screwdriver.
Right.
Addition to that, you will have what we know as the SR, that is the screw remover for removing the abutment. Yes.
Pardon. This last.
This I will explain you all the tools again. I am just actually placing them there, and then you have the placement aid for the 2-piece implant.
Okay.
So this is what a kit would look like if it is both single piece and 2-piece. Okay. So the drilling for the 2-piece implant, again you start with the precision drill.
Right.
It's 2 millimeters in diameter. It has a sharp tip tapered at the end. It has markings again from 6 millimeters all the way up to 20 millimeters. Okay, 6 to 20. And as I said, if there's any doubt, you can always put it against this graduated scale over here and you can get a reference. Okay.
Right.
Once you go ahead with that, you need to put your 2 millimeter pilot drill also up to the desired depth. There are cuts in this drill. These cuts are very helpful. When you take a radiograph with this drill, you can see the measurement in the X-ray as well. Okay. So this is also marked from 8 millimeters to 16 millimeters. Okay. Once you do these 2 drills, then you go to the form drill for the root form. See, you have root form mentioned over here. The form drill has got the basic external body shape of the root form, and then again it is graduated from 8, 10, 12, 14 over here. You can always check the measurement over here on the box. This you will do up to the desired depth. If you are placing a 3.0 millimeter compression root form implant, all the drills you need to do is the precision and the pilot.
Okay.
From the 3.5 drill onwards, 3.5 implant onwards, you will need to use these 2 additional drills. Okay. You will need to use this drill first up to the full depth. After using this drill up to the full depth, it's possible to place the 3.5 millimeter diameter root form implant.
Okay.
Once you have done this up to the full depth, if you are placing a 3.8 or a 4.2 or a 5.5, this is the additional drill that we have only to widen the crest. This is also graduated here. Once again, this is the first marking is the 3.5. The second marking is for the 3.8. Then is for the 4.2. Then is for the 4.2. Then is for the 4.8, and on the top is for the 5.5. Okay.
Right.
So once you have done the depth drill, you just sink the crestal drill up to the desired diameter, 3.5, 3.8, 4.2, 4.8, 5.5. Okay.
Okay.
Now, of course, should there be a situation that you want to put a 5.5 by 6 millimeter implant, this drill cannot be used because here the 5.5 comes at a distance of 10 millimeters. There is a special crestal drill available for the 5.58 and the 5.56, which has the 5.5, then that is only for that particular implant. Okay.
Right.
So this basic kit, what we have tried to do is using minimal components, you should be able to place 90% of the cases. Okay. Because most of your cases are going to be limited up to 4.2.
Right.
3.8 and 4.2 will be the maximum, or 3.5, 3.8 and 4.2 will be 90% of your cases. You can place all those implants just with these 2 drills. Should you need to place a very short 4.8 or a very short 5.5, you need to purchase extra the crestal drills for those. Okay. Once you have made the drilling, then you can take the implant in the green holder, insert it with your hand. Once you insert the implant with your hand, you take the green holder out. I would advise you straight away, actually, you should take out the abutment. So you use the SDL, it is a hex driver. You put it in, you unscrew it as you saw yesterday, and then you take it out completely until it exits the body of the abutment also. Once you have removed the abutment screw, you will take this instrument, we call it SR, okay? It is the removal instrument. So this is the instrument that will help remove the abutment, break away the tight seal friction fit connection between the abutment and the implant. You can't just pull the abutment out, it is totally sealed inside, okay? So you have to insert this, and as you turn it clockwise, it will thread in and it will push out the abutment. So this is the instrument for that. Once you have done that, you can take the placement date, it's a long one with the internal hex, place it in, use the torque ratchet within, set it up to 45 newtons and go ahead and insert your implant. Once the implant is inserted, you can take the cover screw from the back, use the SDL and close it up, okay? And you can save the implant mount or the provisional abutment, whatever you call it, at the time of uncovery to use it maybe as a gingiva former, or you want to do a single stage technique, or you can use it as a transitional abutment, and then you can order the open tray transfers, and you can order the final abutment, and you can go ahead and do your prosthesis. Similarly, maintenance for the torque ratchet, you have to make sure you do the oil at the spring, you do the oil at the area of the graduation, and also you do the oiling in this slot over here, okay? Just to make sure everything stays smooth and as calibrated as possible, okay?
Right.
Any doubts regarding the kit?
No.
It may be possible that, not now of course, but maybe in about 6 months or 8 months, we are also coming up with these set of drills.
Yes, yes.
This is a step 1 here, and this will be put here as a step 2 here. What this will do is now we'll get rid of all these 4 drills that you see on this side. So similarly to the root form, we are also coming up with a 2-step drill for the compression. As I said to you, most cases we are finding that just using the precision and 1 drill we are able to place most implants, and sometimes you only use a crestal drill to widen the crest. So similarly, at some point maybe you may receive a message or an email saying these drills are available. So if it interests you, basically we have a crestal drill for the compression also. So here you can see it's a short drill with a lot of taper. Similarly, it has markings for 4.0, 4.5 and 5.5. So you can do this in D1 bone just in the crest, and then you can go ahead and place the implant after just doing a precision drill to begin with, okay? So this is everything, including future updates, okay? Here is I don't have an implant unfortunately, but what we will use in its place will be the analog, okay? So this is the implant analog. It's metal, it's reusable, okay? And it is an exact replica internally of the implant, yes? Now initially when you have placed the implant, you have on top of it the cover screw, okay? Since we have the chance here and we have some time, I would like to show you. Now if you see, I don't know if you can focus it for you nicely so you can appreciate something here. Can you see that the cover screw is lesser diameter than the diameter of the analog?
Yeah.
It is also this way in the implant.
Okay.
So what does the what this gives us is an opportunity to allow, because as I said, we will be placing this implant about 0.5 mm, sometimes even 1 mm subcrestal. It allows the bone to grow over the shoulder, and that's what's going to give us our platform switch design and our sort of, you can say, a biologic seal, you know.
Right.
So, and to prevent, okay, to try and avoid this crestal bone loss, to maintain the crestal bone at its level, and you know, there are so many advantages to it, okay?
Right.
So anyways, now you have placed the implant. Now the time has come for second stage uncovery. So you have done the exposure. You can use whichever technique you like. There are also punches available, or we can take an incision, which is the better way now, because to preserve soft tissue. One very unique thing about the system which I really appreciate is the gingiva formers. Now you know most of your gingiva formers are one-piece gingiva formers, right? That means they rotate into the place. This means that they have to be circular, correct? In this system, the gingiva formers are two-piece. So there is a gingiva former and then there is the screw inside it. Okay, just like your abutment or anything else. So let me take it out. One second. So here you can see now that I'm holding it.
Yes.
So there is the screw and there is a gingiva former. It has got the same deep cone connection.
Right.
It's got a nice smooth emergence profile coming out as it thin mucosal penetration and flares out as it comes supragingival. What this allows you to do, it allows you to modify this gingiva former. So in case of a molar, you can give it that molar sort of a look, because teeth not necessarily are circular, you know, they're ovoid.
Right.
So you can add some composite, you can add some materials to push the gingiva, put it in the correct place, the gingiva former, and then just, once it's in the correct place, then you can just screw it in, you know.
Okay.
So you are able, and also, so we have gingiva formers in different sizes and different lengths. This is the standard. Then you have the wide gingiva former.
Okay.
This is the wide gingiva former.
Okay.
Or you can use it, for example, in the molar region.
Right.
And if you want, you could also trim it from the sides. For example, I could trim this, you know, from the side, and I could use it as a premolar, so that it has got a long there, and buccolingually it is wider, and mesodistally it is narrower.
Yeah.
I could use it in a central incisor similarly to create that big wide emergence. Okay?
Okay.
So you can customize it, you can put it in the right position, and then using the screw, you can just screw it in properly. This is the screw. You see, it's a separate piece.
Okay.
Yeah? You understand what I'm trying to say, right? Normally you turn in the whole former, it's a circle.
Yeah. Yeah.
So you don't know exactly how it's going to stop, so you can't customize, you can't modify nothing.
Right.
With this, you can customize and modify all the. So all those people who are really fond of soft tissue forming and all that, this is excellent to create beautiful emergence profiles and aesthetics. These are metal gingiva formers. You also get them in plastic, so they're more easy to shape. Okay, once you wait 15 days or 1 month or 1 week, however long you want for the gingiva to mature, depending if you've done grafting or not, you have options for taking impression. Of course, you have your open tray impression post. This is the open tray impression post. You place it into the implant, and you have an option of a long screw. So this makes it extremely convenient, as the screw comes pretty high up into the mouth, so there's no chance of it being covered by any impression material.
Right.
Okay, so you could screw it in with the hand, and you can take it out with the hand. You can also use the screwdriver to take it in and screw it out, depending on what you like. They have a nice holder on top over here, so it's very, very convenient. Okay, once you have taken the impression, of course you take the screw out. Then what you will have to do, depending on tightly you have tightened the screw, you may have to use the remover also, right, to pop out little bit the impression post. Okay, as it may have engaged the most taper very tightly. Okay, idea is don't tighten this screw very, very tight so that it catches. Okay, we don't have to tighten it, just by hand, that's it, until it stops. That's enough. Okay, so what this allows is that when you take the screw out, this impression post can easily come out of the implant. Okay, if you tighten it a lot by mistake, then after removing the screw, you have to use the remover and thread that in so it pushes the impression post out. Okay, is that understood?
Yeah.
That is impressions. Now regarding abutments, these here you can see are 3 abutments. There is the basic abutment or the implant mount that comes along with the implant. It's similar to the abutment of the one-piece implant. Then there is the one that you can purchase. Okay, these are more anatomical
Right.
in shape, and they are available in all your angulations, in 15 degree, 25 degree, different gingival thicknesses. Okay, 3, 5, etc. Okay, and you are also possible to have a locator abutment to use for overdenture. All abutments will come with a clinical screw, and you can use your old screw as a lab screw. Now there is some study about you know, the way the labs are using the screws, they may deform it, or they may damage the threading, which may eventually compromise the capability of the screw. So what happens with this, that you get two screws. So the idea, what you buy with the abutment, you keep with you, and what you receive initially, that is what you send to the lab. Okay, so if they are misusing it in some way, when the job comes back, you just put that screw away. You can use the clinical screw and go ahead and tighten the abutment. Even though this is a cone connection and the screw is not so relevant, but still, just trying to explain to you the attention to detail that is paid over here at every step, you know, that they make sure that through engineering they're able to solve any sort of problems that you may occur to you. Okay, so these are basic